Hello and welcome to Missamma's Kitchen. This is the first episode of news. We are starting with 23 mythbusters and facts for coronavirus. This is a source reported from World Health Organization (WHO). So let's get started. Hope you and your family are staying safe, and let's get started. Myth number 1. Certain drugs are available for the prevention of COVID-19. The fact is, there are currently no drugs licensed for the treatment or prevention of COVID-19. While several drug trials are ongoing, there is currently no proof that hydrochloroquine or any other drug can cure or prevent COVID-19. The misuse of hydrochloroquine or HCQ can cause serious side effects and illness and even lead to death. WHO is coordinating efforts to develop and evaluate medicines to treat COVID-19. Myth number 2. Adding pepper to your meals prevents COVID-19. The fact is, adding pepper to your soup or other meals does not prevent or cure COVID-19. Hot peppers in your food, though very tasty, cannot prevent or cure COVID-19. The best way to protect yourself against the new coronavirus is to keep at least 1 meter away from others and to wash your hands frequently and thoroughly. It is also beneficial for your general health to maintain a balanced diet, stay well hydrated, exercise regularly, and sleep well. Myth number 3. COVID-19 is transmitted through houseflies. Fact: COVID-19 is not transmitted through houseflies. To date, there is no evidence or information to suggest that the COVID-19 virus is transmitted through houseflies. The virus that causes COVID-19 spreads primarily through droplets generated when an infected person coughs, sneezes, or speaks. You can also become infected by touching a contaminated surface and then touching your eyes, nose, or mouth before washing your hands. To protect yourself, keep at least 1 meter distance from others and disinfect frequently touched surfaces. Clean your hands thoroughly and often and avoid touching your eyes, mouth, and nose. Myth number 4. Bleach or any other disinfectant might protect you against COVID-19. We all know the source of this myth. Fact is, spraying or introducing bleach or any other disinfectant into your body will not protect you against COVID-19 and can be dangerous. Do not, under any circumstance, spray or introduce bleach or any other disinfectant into your body. These substances can be poisonous if ingested and cause irritation and damage to your skin and eyes. Bleach and disinfectant should be used carefully to disinfect surfaces only. Remember to keep chlorine and other disinfectants out of reach of children. Very important. Myth 5. 5G mobile networks spread COVID-19. Fact: 5G mobile networks do not spread COVID-19. Viruses cannot travel on radio waves or mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks, like in India. COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. People can only be infected by touching a contaminated surface and then their eyes, mouth, or nose. So wear a mask, people. Myth 6. Methanol, ethanol, or bleach might prevent or cure COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous. Methanol, ethanol, and bleach are poisons. Drinking them can lead to disability and death. Methanol, ethanol, and bleach are sometimes used in cleaning products to kill the virus on surfaces. However, you should never drink them. They will not kill the virus in your body and they will harm your internal organs. To protect yourself against COVID-19, you know what to do. You need to disinfect objects and surfaces especially the ones you touch regularly like doorknobs and other things like railings on steps. You can also use diluted bleach or alcohol for that. Make sure you clean your hands frequently and thoroughly and avoid touching your eyes, mouth and nose. Myth number 7. Sun or higher temperatures prevents coronavirus disease. Exposing yourself to sun or to temperatures higher than 25 degrees Celsius does not prevent nor cure COVID-19. You can catch COVID-19 no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. To protect yourself, make sure you clean your hands frequently and thoroughly and avoid touching your eyes, mouth and nose. Myth number 8. Catching the new coronavirus means you will have it for life. The fact is, you can recover from coronavirus disease. Catching the new coronavirus does not mean you will have it for life. It's like any other virus. Most of the people who catch COVID-19 can recover and eliminate the virus from their bodies. If you catch the disease, make sure you treat your symptoms. If you have cough, fever, and difficulty breathing, seek medical care early, but call your health facility by telephone first if possible. Most patients recover thanks to supportive care. Myth number 9. You can confirm coronavirus disease with breathing exercise. Fact: being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus disease or any other lung disease for that matter. The most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe forms of the disease, such as pneumonia. The best way to confirm if you have the virus producing COVID-19 disease is with a laboratory test. You cannot confirm it with this breathing exercise, which can even be dangerous. Myth number 10. Drinking alcohol protects you against COVID-19. This is one of the famous myths that we have been hearing or reading through forwards. The fact is, drinking alcohol does not protect you against COVID-19 and can be dangerous. Sorry to disappoint some of you. Frequent or excessive alcohol consumption can increase your risk of health problems. Myth 11. Hot and humid climates protect you against COVID-19. Fact: COVID-19 can be transmitted in areas with hot and humid climates. The COVID-19 virus can be transmitted in any climate, including areas with hot and humid weather. The best way to protect yourself against COVID-19 is by maintaining physical distance of at least 1 meter from others and frequently cleaning your hands. By doing this, you eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, mouth and nose. I'm going to repeat this stuff, so be careful and make a note of this and spread the information. Myth 12. Cold weather and snow kill the new virus. Fact: cold weather and snow cannot kill the new coronavirus. There is no reason to believe that cold weather can kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 and 37 degrees Celsius, regardless of the external temperature or weather. The most effective way to protect yourself against the new coronavirus is, you know what to do. Frequently clean your hands with alcohol-based hand rub or washing them with soap and water. Myth number 13. Taking a hot bath prevents the new coronavirus. Fact: taking a hot bath does not prevent the new coronavirus disease. Your normal body temperature remains around 36.5 to 37 degrees Celsius, regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot water can be harmful as it can burn you. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this, you eliminate viruses that may be on your hands and therefore avoid infection that could occur when you Then use the hands to touch your eyes, mouth and nose, which can happen unknowingly. Myth 14. Coronavirus can be transmitted through mosquito bites. Fact: the new coronavirus cannot be transmitted through mosquito bites. To date, there has been no information or evidence to suggest that the new virus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. Also, avoid close contact with anyone who is coughing and sneezing. Myth 15. Hand dryers kill the new coronavirus. Are hand dryers effective in killing the new coronavirus? No. Hand dryers are not effective in killing the COVID-19 virus. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. Myth 16. Ultraviolet or UV lamps can be used as a disinfectant. Fact: UV lamps should not be used to disinfect hands or any other areas of your skin. UV radiation can cause skin irritation and damage your eyes. Cleaning your hands with alcohol-based hand rub or washing your hands with soap and water are the most effective ways to remove the virus. Myth 17. Thermal scanners detect people infected with new coronavirus. How effective are thermal scanners in detecting people infected with the new coronavirus? Thermal scanners are effective in detecting people who have developed a fever. That is, they have higher than normal body temperature. That is about more than 37 degrees centigrade Celsius. They have a higher than normal body temperature because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes about 2 to 10 days before people who are infected become sick and develop a fever. Myth 18. Vaccines against pneumonia protect you against new coronavirus. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia such as pneumococcal vaccine and Haemophilus influenza type B HIV vaccine do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against 2019 nCoV and WHO is supporting their efforts. Although these vaccines are not effective against 2019 nCoV, vaccination against respiratory illnesses is highly recommended to protect your health. Myth 19. Rinsing your nose with saline prevents infection with the new coronavirus. Can regularly rinsing your nose with saline help prevent the infection with the new coronavirus? No. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infections. Myth 20. Eating garlic prevents infection with the new coronavirus. Garlic is a healthy food that may have antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Myth 21. The new coronavirus affects only the older people. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. WHO advised people of all ages to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Myth 22. Antibiotics prevent or treat the new coronavirus. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics do not work against viruses, only bacteria. The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you're hospitalized with the 2019 nCoV, you may receive antibiotics since bacterial co-infection is also possible. And lastly, myth number 23. There are specific medicines to prevent or treat the new coronavirus. To date, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. So there you go, people. We have included 23 myths and facts that are provided by WHO. Hope this helps, and you and your family stay safe and healthy, and let's all fight back on this virus. Stay safe and stay strong and stay happy. Thank you for watching. Please do like, share and subscribe to our channel. Thank you and have a good day.